Hello, I'm Dr. Karuna, obstetrician and gynecologist at Akkineni Hospital. Hope you're in good health. Today, we'll cover some key information. Stay with us and note it down.
So, if you're expecting a baby, you're probably getting advice from pretty much everyone, right? Your doctor, your mom, your in-laws. It can get so overwhelming. Today, we're going to cut through all that noise to figure out what an empowered birth really looks like, and more importantly, how you can actually have one. We're going to start with this quote from obstetrician Dr. Vellanki Karuna because it reveals something, well, really surprising. You would think the number one fear for a pregnant woman is about the pain of labor or maybe the medical procedure itself, but so often it's something much, much closer to home. And this brings us to something that doctors see every single day, but we just don't talk about it enough: a mother's hidden fear. I mean, really think about it. Of course, there's the medical side of things, the pain, the recovery, but what often weighs even heavier on your mind is the pressure from family, from in-laws, this whole chorus of opinions on how a baby should be born. It can feel, honestly, suffocating. Okay, so let's cut through that noise for a second and just ground ourselves in the facts. We'll start with the big medical choice here: a normal delivery versus a C-section. What are the actual medical realities? All right, let's be perfectly 100% clear about something right up front. Neither one of these is inherently better. A C-section is not a failure, and a so-called natural birth isn't some prize you have to win at all costs. They are simply two different, totally valid and safe paths to the exact same beautiful destination: a healthy baby and a healthy mom. See, each one has its own distinct purpose. Now, a normal delivery, when it's medically appropriate, yeah, it can mean a faster recovery and fewer risks in your future pregnancies. But a C-section isn't just a plan B, it is a critical, often life-saving procedure when the health of the mother or the baby is actually on the line. But here's where it gets complicated. If both are just tools for a safe delivery, why is one being used so much more in some places? Just look at this number: 47%. That's the C-section rate in private hospitals in India. Nearly half. And while some are absolutely necessary, a lot of the data suggests that many are not. This just goes to show you that the decision isn't always purely medical. It's often influenced by convenience, hospital policies, and yep, you guessed it, that family pressure we keep talking about. And that brings us right to the heart of this whole conflict. It isn't just about medicine, it's about the intense, sometimes overwhelming pressure of opinions, and how family beliefs can turn your own personal journey into this really stressful debate. So it all boils down to this one huge question, doesn't it? You've got your doctor giving you medical advice, your family giving you, well, other advice, and your own feelings are just caught right in the middle. So who actually gets to make the final call? And you know what's so confusing? The pressure often comes from two completely opposite extremes. On one side of the family, they might be pushing for a C-section, thinking it's more modern or somehow safer. And on the other side, they might be insisting on a natural birth at all costs, holding on to tradition. For the mother who's caught in the middle, it's a total no-win situation. And that is why this next statement is the absolute core of this entire topic. Let's just let it sink in for a second. A mother's body is not a battleground for family opinions. It's your personal space. It deserves respect. It is not a territory to be won over by someone else's beliefs. So, how do you get off that battleground and get back in control? Well, let's build a framework for empowerment. This is all about putting the decision-making power right back where it belongs, with you. Your biggest ally in all of this is your doctor. Their role is purely medical and objective. They're looking at your health, your baby's position, your medical history. Their recommendation should be based on one thing and one thing only: what is the safest path for you and your baby? It's not about convenience, and it is most certainly not about what your aunt thinks is best. Okay, so here's a simple three-step path to help you make your own choice. First, just acknowledge the pressure. Actually say it out loud. Family opinion is separate from medical advice. That simple act is so powerful. Second, ask your doctor questions. Lots of them. This is your body. You have every right to understand everything. And finally, step 3, own your birth plan. This isn't your doctor's plan or your family's plan. It's your plan, one that you create together with your medical team. You know, ultimately, this all leads us to a new way of thinking. It means we have to completely redefine what a good birth actually is. The goal isn't a specific delivery method. It's about having a specific kind of experience. This is the new goal: an empowering birth. It's an experience where you feel informed, you feel respected, and you are central to every single decision.
Whether it's a normal delivery or a C-section, that becomes secondary. The true success story is you being an active, respected author of your own birth experience.
So, we're going to leave you with this question to carry with you. What does an empowering birth look like for you? Just for a moment, forget everyone else's definition. Answering that question for yourself, that is the most powerful first step you can possibly take. Thanks for joining us.